osteomalacia. It is a metabolic disorder occurring in the adult age, in which there is softening of the bones due to weakness in the production of the matrix or the bone density. Now the structure of the bone is, it consists of two parts. Outer one is cortical, which is hard, horny and resistant portion, in which there are located eversion canals containing blood vessels and nerve endings, while the inner portion is spongy, in which there are two types of cells, osteoclast and osteoblast, are nourishing. The function of the osteoblast is constructive, that is production of the bone material and the addition in the bone density up to the age of 30 years. Afterwards, its function is decreased progressively due to invasion of the osteoclast, which are the destructive cells, that produces decalcification of the bone or the resorption of the bone. In osteomalacia, the main factor is deficiency of vitamin D. Vitamin D is obtained in the form of nutrition and food which we ingest, and that is absorbed through the small intestine in the bloodstream. And second method of production of the vitamin D is from the ultraviolet rays of the sun. This is the natural source of vitamin D to the human being, which is produced under the skin from the component of the cholesterol. The vitamin D absorbed through the intestine and from the ultraviolet rays of the sun, that goes via bloodstream into the liver. From there it is metabolized and is converted, further is conveyed to the kidneys. There are enzymes which convert this inactive form of the vitamin D into the active form of vitamin D, that is vitamin D3 and D2. This form of vitamin D function as it accelerates the absorption of the calcium and phosphate elements through the small intestine from the food ingested. Moreover, it also promotes the deposition and entry of the calcium and phosphate into the bone matrix. Next, it also decreases and controls the excretion of the phosphate mineral through the kidney filtration in the urine. Osteomalacia is a very alarming disorder of the bone, especially the disease or disorder is produced in the hips, spine, lower limbs, ribs, due to which there are multiple fractures even after slight stress and or weight bearing activity, because there is softening of the matrix of the bone due to non-availability of calcium and phosphate or entry in the bone cells or osteoid cells. So the main function is of vitamin D is for the formation of the human bone, its strength, so that it can resist the external forces and the stresses and trauma. When there is deficiency of vitamin D, subsequently there is decrease in the availability of the calcium and phosphate into the bones. The level of the calcium phosphate is decreased in the blood, due to which the parathyroid gland come into action and produces an excessive amount of hormone, parathyroid hormone. The function of parathyroid hormone is destructive, I mean is decalcification. Mineralization is produced, due to which calcium and phosphorus is resolved from the bones into the blood. Subsequently, the bone mass is decreased, they become fragile, tender, and susceptible to the frequent and multiple fractures. Due to multiple fractures and multiple deformity, the function of the person is limited. So this disease is a disabling one. In addition to this, there are various pathologies in the gastrointestinal tract, carcinoma tumors, and celiac Crohn's diseases. They also decrease the absorption of the vitamin D as well as calcium and phosphate element into the blood. So this is the pathogenesis which leads to the formation of the softening of the bones, and the disorder produces osteomalacia.